Thank you for taking the time to prepare for your upcoming surgery by participating in our preoperative total joint class educational program. Here at Geisinger, we value your success, and it is important to us that you understand the following information, which will help you and your family prepare for your upcoming total knee or total hip replacement surgery. Everyone is understandably nervous and somewhat vulnerable when planning for an upcoming surgical procedure. By participating in our preoperative total joint program, you will be more informed, increasing your awareness and decreasing your anxiety. If you or your family have any questions related to the information provided, please do not hesitate to reach out to the surgical team. You may discuss your questions and/or concerns with nursing, advanced practitioners, or your surgeon. Geisinger is a large healthcare organization, and no matter the location in which you are scheduled to have your surgery, you can expect the same great care. Our teams work together to ensure you are medically optimized and scheduled appropriately to achieve surgical success. When you come in for surgery, you are a predetermined fall risk because your musculoskeletal system is compromised. After surgery, you are at a greater risk for falling because you underwent reconstructive total joint replacement surgery. Preoperatively, you will be provided a yellow arm bracelet that reads fall risk. If you are receiving a total knee replacement, you will be offered a nerve block. This is very much like when you go to the dentist and receive Novocaine. You can't feel your face for some time until the medication wears off. Nerve blocks are similar, and you will have decreased sensation in the operative leg. The nerve block is administered by anesthesia, which may last anywhere from 24 to 48 hours after surgery. Please notify the staff if you are not able to feel sensation if you are greater than 48 hours. This is helpful with pain management, but also increases your risk for falls. Your knee may buckle, and you will not have total control of your leg until the nerve block wears off. Therefore, please be aware of the call bell and how to use it. You must always call for help. In other words, call, don't fall. There are simple tasks that can help you prepare your home to prevent falls, which include remove throw rugs and clutter, always use your assistive device, and remove trip hazards such as extension cords. Always remember, pets are also fall risks, and they know when you are not feeling well. Please be sure to have a safe plan for your pets. Also, please rearrange your furniture to ensure safe pathways to allow you to navigate when ambulating with a rolling walker. Besides the nerve block, we offer scheduled pain medications. These are medications that you don't have to ask for, and they will help you remain comfortable during your postoperative recovery period. We will also offer you as-needed medications and breakthrough medications. Most as-needed and breakthrough medications are opioids, which are controlled substances. Please do not panic. These medications are prescribed in a safe environment to avoid uncontrolled pain. Please be sure to express pain when laying, sitting, and walking. All persons experience pain, but some tolerate pain better than others. Nursing will administer pain medications. Please do not hesitate to ask for pain medications. We encourage you to take the pain medications with food and at least 30 minutes prior to physical and occupational therapy. To aid with communication, we have dry erase boards beside each patient bed. This is where we write when you had your last as-needed or breakthrough pain medication, when you could have your next dose. This way, you'll be informed. Take care.